I know you're very busy today. How are you?
I'm good. It is a busy day. And when things go wrong with your computer, you feel like throwing it at the wall.
Yes, exactly. It's one of the most frustrating, and you just feel so.
Especially since you don't know how to fix it. I think instead of what we were going to say today, I'd like to talk about the dietary guidelines that just came out last week. You asked me about them last week, and I've had a chance to partially read through them. And I actually sent out a notice that afternoon about the guidelines to everybody. The original concern I had with the guidelines was from July of 2015. I wrote a note about lies and damn lies. You can look at it in the newsletter. And what I called these were damn lies because they hurt people and they hurt the planet. The lies that were being told by a couple of doctors who wrote an opinion piece in the Journal of the American Medical Association. They applauded the fact that cholesterol was now considered a non-nutrient and didn't have to be worried about. And they also were applauding the fact that they were taking away the limits on fat intake. So you could eat as much fat and cholesterol as you wanted. Well, cholesterol it comes from animal products solely. So when you say you can eat as much cholesterol as you want, you say you can eat as many animals, pigs, cows, snakes, chickens, fishes, snails, whatever you want. Complete elimination of restriction when you remove the cholesterol restriction. When you say you remove fat restriction, that means you can eat vegetable oils and animal fats. Well, as it turned out, and I sent out a notice to all of you about this just last week, what the dietary guidelines finally ended up saying was that we're going to remove the restriction on cholesterol, but it doesn't mean you can eat as much cholesterol as you want, and you might consider the advice of the Institute of Medicine, which says you should eat as little cholesterol as possible. Well, eating as little cholesterol possible is eating the McDougall diet, the starch-based diet, because cholesterol is only in animal foods. So really they recanted. And even though there was tremendous pressure, and I'll tell you about that pressure in a minute, from industry to get people to eat as many animals as they could stuff in their face. That's what the lobbyists, particularly from the egg industry, tried to get the dietary guidelines for 2015 and 2020 to state. Well, they didn't get them to state that. They said they took off the limit of 300 milligrams, which has been around for probably 20 years. But in the next sentence says that doesn't mean you can eat all the cholesterol you want. And in the next sentence, they said you might consider following the Institute of Medicine guidelines, which says you should eat as little cholesterol as possible, and that means none. So in my opinion, that paragraph states that the U.S. dietary guidelines for 2015 to 2020 mean that you should be eating the McDougall diet, period. Now, as you read through that document, you'll see the heavy influence of the dairy, meat, and egg industry and fishery industry. The guideline committee came out with statements about these foods saying that they contain important nutrients, but the truth is you can get all of these important nutrients from plants in a much safer form, except for B12, and we discuss that later. So yes, you can get calcium, but at great risk to your health. You get all that saturated fat, which they warn strongly against eating saturated fat. Saturated fat is synonymous with animal foods. So all through the document, they say you need to get important nutrients from meat, from fish, from dairy products. But in the next somewhat hidden statement, paragraph sentence, they say you need to seriously limit your saturated fat. So they tell you on one hand, you get dairy, but don't get saturated fat. So I guess that means low-fat dairy. Nowhere in that document do they tell you that you have no need for dairy products to get calcium. There's no such thing as dietary calcium deficiency, which is the pitch the dairy industry has been giving us to get us to buy their products. They pick out something that's unique about dairy. It's got lots of calcium, but nobody's ever developed dietary calcium deficiency. So you're fighting against a disease that doesn't exist. The same thing with eggs and meat. They say these foods are loaded with protein, but they don't in the next sentence tell people that there's no such thing as dietary protein deficiency. It's never existed. No one has ever gotten a case of protein deficiency by eating any natural diet. And neither of these unique positioning statements about calcium and protein do they tell you about the harmful aspects of these foods. The contamination with environmental contaminants because they're high on the food chain. The contamination with microbes like mad cow and E. coli and salmonella and listeria. They don't go into that at all. It's the same thing with the fish issue. They say you need to eat omega-3 fats, but they don't tell you that fish don't make omega-3 fats. They're only made by plants. If you do click on a subsection about fish in there, they do tell you, they warn you about methylmercury and how you can tell how much fish a person eats by the amount of methylmercury in their body, because it's almost the sole source of methylmercury. And methylmercury is a serious neurotoxin. So you see industry's heavy footprint over telling Americans to eat these foods because they need special nutrients, nutrients that are in high concentration in these foods, which would be meat, dairy, eggs, fish. But they don't tell people that there's no such thing as a deficiency if you don't eat these foods. They don't tell them that. And then they don't turn around and tell them about the poisons, the environmental contaminants, the cholesterol, the saturated fat. They do the saturated fat a bit. And the methylmercury, they don't do that. So this is just a sloppy guideline put together to promote meat, dairy, and eggs from the meat, dairy, and egg industry, which is the job, by the way, that the United States Department of Agriculture is to promote agribusiness. Now, this gets me to one more point that I'm going to write about in my next newsletter. The Physicians Committee for Responsible Medicine, along with myself and a couple of other doctors, have filed a lawsuit against the head of the dietary guidelines, against the dietary guidelines member. And that lawsuit states that they used experts, Alice Lichtenstein, a few other experts from Kraft Foods and Cleveland Clinic and other universities. The egg industry bought these experts and put them on the guidelines committee. And then what they did is they falsified the scientific literature by only using studies paid for, almost exclusively paid for by the egg industry to show the benefits and risks of eggs. They completely ignored the scientific research done by independent researchers and research done before the 1990s, when it wasn't contaminated by industry. Now you can read our lawsuit against the members of the Human Health Service and the U.S. Dietary Guidelines. You could read that. I think I'll give you the link, Gustavo, and you could put it up on our website. And the next newsletter will give you the link through it too. And you'll read a legal document, a multi-page legal document, showing how they manipulated the literature, they manipulated the methods and studies they paid for to show that eating eggs is irrelevant, not harmful, not important, and they ignored the literature. And we'll point all of that out, all that literature out that they ignored out, and how they did it purposefully, and they're being sued to reclaim legal fees and to reword the message to the people of America. In fact, the lawsuit goes under the supposition that what the dietary guidelines for 2015, 2020 have done is they have personally harmed my patients and made it unable for me to take care of people with diseases like diabetes and heart disease. And so this is, in my opinion, well, it's illegal, but it's also criminal to hurt people for the sake of making more money for industry. Now, they're going to lose this suit. I have no doubt they're going to lose this suit. In fact, they already have, because in the July JAMA, that opinion piece that I referred to, I believe it's in my June or July newsletter, about lies and damn lies. They thought they were going to get away with getting into the dietary guidelines the idea that cholesterol was a non-nutrient, a non-issue. You shouldn't even consider it, and that we should be able to eat as much fat as we wanted. Because of this lawsuit, I believe, filed by PCRM with my help and a few other doctors' help, they didn't do that. They didn't get away with it. They have strong warnings about eating saturated fat, which is synonymous with beef and poultry and eggs. They lost that one, and the dietary guidelines issues adequate, well, at least they issue warnings about eating these foods, even though they're buried after the reasons you must eat dairy and meat. And they lost it because, yes, they said they removed any upper limit of 300 milligrams of taking in cholesterol, but the next sentence says that doesn't mean you can eat all the cholesterol you want. And the next sentence says you should follow the advice of the Institute of Medicine, which says you should eat as least cholesterol as possible, which means none, which means you need to eat the diet I recommend of starches, vegetables, and fruit, because cholesterol is only in animal foods. So we'll put the link to that lawsuit up as soon as we can today. It'll also be the subject of the newsletter at the end of the month. I'll keep you up to date on how we do in that lawsuit. I hope it becomes extremely public. And even though people know industry has a huge influence over guidelines on what we should eat, over the health of your children, your school children, your husband who just had a heart attack, even though people at one level realize they have an influence, you just have no idea how huge that influence is. But this lawsuit will point out that they can lie, they can manipulate the literature, and they think they can get away with it, except for people like Neil Bernard at PCRM, myself, and a few other doctors who are willing to stand up and say, you guys are liars, and you're going to get sued for it. And they're getting sued for it. And we're going to beat their buns, and we're going to make it so public. Hopefully they can't stop it.
Well, what you said, Dr. McDougall, we're looking forward to the link. What I would put in the description of the media for everyone later on.
Read it.
When I read it the first time, I got the idea, the word that you said describes it perfectly. Sloppy and confusing, and if it could be reworded, why can't they say things straightforward and clear?
Because their obligation is to agribusiness. The USDA, their primary obligation is to keep the egg industry alive. Even if the egg industry is killing your dad and your brother and your husband, their job is to keep industry alive, and that they're doing their job. So I think this could be pivotal, this lawsuit, particularly if it goes forward. If the courts allow it to go forward, particularly if the media follows it as if it's a difference between life and death for people, for the United States of America, and even for planet Earth, because it could be. If we could bring out to the public how clearly these people get away with telling bold-faced lies, manipulating the literature, suppressing the truth. And the consequence isn't just a little stomach ache.
Right. Well, thank you so much for talking to us about this. We will leave the topic of today's webinar, hopefully for next week, since we started late, and I know you have several appointments. So today, our webinar is a little shorter than other weeks.
A little shorter, a little different subject, and
right.
It got me a little more riled up than usual, didn't it?
Yes. Well, thank you for being here, Dr. McDougall. We will be looking forward to seeing you next week again.
Thank you very much. I'm sorry it was just a short time. Technology got us, and I don't even know what we did wrong.
I know. I mean, people, we do test these systems, and we don't just jump in. It's just technology is unpredictable, and we just have to learn to live with it. But thank you, Dr. McDougall, again.
I'll see you later. Bye-bye.
All right. Bye-bye.